I was first diagnosed with Parkinson's in January 2010, and one of the side effects of the Parkinson's was that I was having difficulty breathing and digesting food. Digestion of the food, which was going down the my windpipe, was causing me to have then coughing and panic attacks, so that I was getting near to the point of sometimes passing out. The panic attacks caused dizziness, and I was, like as I call it, seeing stars. Yeah, the specialist decided that I should see a speech and language therapist who would contact me within the next few days. And they did so within a couple of days. They contacted me to actually come round to my house to observe me eating food, which was going to be at breakfast time. For about 2 months, she kept in contact and was interested in what was happening. At one point, my saliva started increasing, and I had to contact her to see what could be done. She suggested that she would need to check with the doctor. She did this very, very quickly. Within half an hour of leaving my house, I had the confirmation on the phone from her to increase the dosage of the spray to 4 times a day instead of 2. The treatment that I got was absolutely first class. The time taken to respond, and the very fact that she was coming to my house to see me, and I wasn't having to wait in a queue as you do to see the specialists. This made it very, very convenient, and when she was observing me eating food, that was far better, being in my own home.
I see patients in their own homes, in nursing homes, residential homes, and I have spent a bit of time in the hospice. I generally work with progressive neuro clients, so the people with motor neuron disease, MS, Parkinson's, Alzheimer's, and a few stroke patients as well. Our referrals that come through to the community team are coming generally from GPs, consultants in neurology, stroke, the nursing homes, the residential homes, allied health professionals such as the physios, the OTs, dietitians, and also from the specialist nurses in Parkinson's disease, motor neuron disease and MS. Swallowing is a complex process that we take for granted every day, and when people have motor neuron and MS, it can have a huge effect on their life. It can range from a mild problem to a life-threatening illness if we end up with chest infections and pneumonia. I concentrate on the swallowing problems, the amount of swallowing problems at the different stages of the swallow. When we see patients, we assess them and then devise a management plan. There can be a huge problem with things like dentition and chewing ability, which can affect the textures that we offer patients. So within our management plan, we'd look at different consistencies of fluid and different consistencies of diet. Our main concern is an aspiration risk, so food and drink going down the wrong way, which can lead to chest infections and aspiration pneumonia, which can be fatal in the elderly and weakened population generally. The other thing that we've got to take into consideration is that dysphagia can lead to social isolation. So people withdrawing from meal times, eating alone, avoiding certain foods or textures or situations. So working with this client group, working with the families, I feel as though I can make a difference and improve hopefully quality of life, and that's a worthwhile job for me.